Hi and welcome to this program of somatics. I'm Sol, and today I'm gonna give you some wonderful and gentle movements, which is the third program of the series of upper back. So to reduce tensions and pain in the upper back of your body, these movements are gonna help you. The programs that I've made for you, you can use them individually or you can combine them. One program, two or three, everyone together, or you can even pick and choose movements from each program and create your own. In somatics, we are inviting to use the whole body, the whole soma as a system, because there are no muscles working in solo, they're all working together in groups. And in somatics, we are doing the movements that are involving the whole system, the whole muscle system. You're going to move really slowly in this movement practice and never go into pain. So I am inviting you to do small movements and listen to the body's impulses. Where are your boundaries? Where are your limits? So if you feel stiff and you have pain, please do this movement smaller, slower, and you can even imagine, visualize the movement and have benefits. And for a long-lasting effect of the movements, practice daily. If you want to have a plasticity really change and transformation in your nervous system that is controlling your muscles and movements, you need to practice daily. So these movements are involving movements for the whole body, for the whole center of the body, with rotation and twist. And we're also going to have focus on the shoulders in the front and the back. So even though we are using the center, we're having the main focus on the upper part of the back and also the shoulders. So before you start, please lay down. We're going to do a body scanning so that you can sense and feel your body from within to start with. And maybe you will notice that when you start the program, you don't feel the body is relaxing at the floor, and maybe after you finish your practice, you might sense that you're relaxed, more grounded, maybe you're laying flatter on the floor. If you need support under your head when you do the scanning or under your thighs and knees, please bring a blanket or cushion. And when you do the body scanning, if you can have the eyes closed, do so. If not, you leave them open. So let's start. You're going to lay down, and if it doesn't feel okay to have the feet straight, you can bend your knees, put the feet to the ground, and even put some blankets under your thighs and knees if you need to. So close your eyes if that's okay for you, or leave them open. And just start by sensing and feeling yourself from the inside out. It's like a mindfulness or bodyfulness. You're sensing what is without any judgment. So just feel the pressure of the body towards the floor. And is there a difference between the right and left side? Is it so that it's equal, the pressure to the floor, or is there more pressure to one side compared to the other one? One side feeling flatter or heavier compared to the other? Notice the feet. How are they resting on the floor? Are the feet rotating out? Are they standing straight up? And is there a difference between the right and left foot? And how do you experience your legs? Are they relaxed? Is one leg closer to the floor? And what about the pelvis? Is the weight equally balanced on the pelvis, or do you feel like the pelvis is tilting more to one side compared to the other one? Maybe one side feels flatter or heavier. And even notice if you feel that Your pelvis is tilting forward, and maybe there is an arch in the back, or your back might be pressed slightly to the floor and pelvis tilted back. If so, maybe you can sense if the tummy is tight. Or do you feel that you're imbalanced in the center? And sense the lower part of the back. Is there an arch in the back? Is it flat to the floor? Is it relaxed or tight? And also sense, how is the back, the rest of the back resting on the floor? Is there a difference between the right and left side? Maybe one side is flatter than the other one. And how are the shoulders? Are they resting equally on the floor? Or is one shoulder closer to the floor than the other one? Are the shoulders pulled in towards the spine, or do you feel they are lifted towards the ceiling? And notice the neck. Is it relaxed or tight? Straight or bent? And notice your breath without changing it. Just notice. Are you breathing with the chest? Or are you breathing with the belly? Maybe the breath is free, maybe the breath is restricted. It is like it is. So we're going to start the movement. And you can put one foot at the ground and then the other one. Bend your knees. Put your feet in hip width distance apart. So the reason why the feet are hip distance apart is because then the knees and the hips can relax. Feet too far away will make the knees fall in, and feet too close will make the knees fall out. So find a place where you can relax the hips and knees, and not too close to the glutes and not too far from the glutes, because that will have something to do with the movement possibility you have in the pelvis. So find the spot in between, and so that you can move with ease. The first movement you're going to do is called the arch and flatten. And to the arch and flatten, we're going to bring in the arms in a position called cactus arms. So the cactus arms means that you are bending the elbow 90 degrees angle and having the hands with the palm facing up towards the ceiling, and the arms are resting down on the floor. So we're coming back to the arms later. So now we're going to start by using the pelvis, moving the pelvis first, and just rest your arms along the side. But now you know what's coming. So let's start with the movement of the pelvis, and you can begin by noticing the breath. And feel if you can sense the breath is in the belly. And when you take a nice and deep breath in, notice if the belly is floating towards the ceiling. And without pushing and pressing the belly up, just notice the movement. And if there is a struggle to contact the belly with the breath, you can leave a hand on the belly or both hands, and notice if the hands are raising up to the ceiling as you're breathing in. So we're going to move the pelvis gently, and we're going to start with a flatten movement. So you can breathe in to begin. And as you breathe out, you're going to flatten the back towards the floor and tilt the pelvis backwards towards the chest, towards the head, so that the belly is getting tighter and the back is flat on the floor. And then really slowly release from there. In somatics, we are releasing the tensions really slow, because then the brain and the nervous system, the spinal cord and the muscles are communicating. If you're just dropping out of a movement, there's no learning, there's no brain, voluntary movements from the brain involved in the movement. So you cannot regain better control and better muscle function if you're just dropping, releasing fast. So please do that really slow. So once more, take a nice and deep breath in. And as you breathe out, roll the pelvis back, flatten the back to the floor, and notice if you can feel the tummy tighten up. And slowly release. And once more, you breathe in to get ready. And as you breathe out, sink down to the floor with the back, roll the pelvis backwards towards the head. So the pubic bone is coming closer to the navel. You can stay there and breathe as normal. Could you also see if it's possible for you to help the ribs down towards the belly, so that the front side is actually shrinking a little bit. Pelvis towards chest, chest towards pelvis. They are connecting more towards each other. And really slowly release them there. And one more time, breathe in to get ready. And as you breathe out, flatten your back to the floor, roll your pelvis back, closer to the chest. Sink the chest closer to the belly and allow your shoulders to lift from the floor. And you might notice that the neck is a little bit bent and your head is resting more on the top of the back side. And release. If you're stiff and tight in the neck, there might not be so much movement in the neck, but please allow the neck to join the movement. Relax as much as possible. So let's go the opposite direction. As you're breathing in, will you tilt the pelvis forward, away from the head towards the feet. So you're rolling and tilting the pelvis forward and arching the small of your back. So your back is more lifted away from the floor. The front side is relaxed. The belly is floating towards the ceiling. And let the back muscles slowly release out of the tensions. It's melting back to the floor. And once again, as you're breathing in, you're tilting the pelvis forward, opening the distance between the pelvis and chest, arching the back, relaxing the belly, and allow the neck to release and be long and straighter. Melt out of that. And once more, you're breathing in, arching the back, tilting the pelvis forward. And sense and feel if you can notice that the back is getting tighter, muscles getting used, activated. And allow the neck to relax and release and melt back down. So now we're going to bring the two movements together as one, arch and flatten. You start by breathing in, rolling the pelvis forward, and you breathe just as you need to, relaxing the front, activating the back. Melt back to the floor. Sink down into the mat, roll the pelvis back towards the chest and allow the chest to sink down to the belly and the shoulders lifted gently up from the floor, and your head is resting on the floor with a bent neck. Slow and gentle, never go into pain. Release. Breathe in, arch the back, tilt the pelvis forward, freeing the front, activating the back. Melt back to the floor, roll the pelvis backwards, and allow the chest to sink down to the belly, shoulders coming up, and head bend back, and come out. So now we're going to bring in the arms. Would you put them in a T straight out from the body? And then you bend the elbows 90 degrees angled, and your fingers are pointing straight up to the ceiling, and the palms are facing towards the feet. So from this angle, 90 degrees angle in the elbows, fingers pointing like antennas to the ceiling, palms facing towards the feet. Now you're going to start to melt the arms backward towards the outside the head, palms facing up towards the ceiling. And as you're slowly letting the hands float down to the floor, would you gently start to press the elbows towards the floor and also the hands in the direction of the floor. And you might feel that you come a certain way and here the arms stop. So you don't have to press them down, they don't have to meet the floor. It's just in the direction of, so they're floating back on the outside of the head, one on each side. And when you come down there, gently start to press the elbows to the floor, and maybe you can notice that the shoulders are going closer to the spine, and your hands push them gently closer to the floor within your comfort zone. And then release, come back to neutral, your hands up. Once more, as you're breathing in, gently move the hands back. Palms facing the ceiling now. Gently push shoulders in towards the spine, push gently the elbows towards the floor, and slowly release. Come back to neutral. And now we're going in the opposite direction, so you're going to gently let the hands float down towards the floor with the palms facing down closer to your hips. So come back up. So take a nice and deep breath in. As you're breathing out, gently lower your hands towards the floor outside your hips. Palms facing down, and as you're putting them towards the floor or in the direction of the floor, they don't have to touch. Gently start to press your hands closer to the floor and notice what's happening up in the shoulders. Maybe you can sense that the shoulders are being lifted up towards the ceiling and the head is gently being bent back. And the chest is sinking closer to the belly. Come back to neutral. Let the hands and the fingers be antennas again towards the ceiling. Breathe in to start, and as you breathe out, lower your hands towards the floor outside your hips. Let the shoulders float forward towards the ceiling, ribs and chest sinking down towards the belly. Head is hanging gently back on the floor. And come back up. So this is the movement of the arms, and now we're going to bring in the pelvis together with the arms and the shoulders. So this movement, it's not so much about the arms, it's more about what's going on in the shoulders and then the upper part of the back and upper part of the front side. So as you're breathing in, roll the pelvis forward and arch your back. And at the same time, gently lower your hands back towards the head, one on each side. Gently pushing elbows to floor, pulling shoulders in towards the spine. Release the neck. Slowly release out of that one. Relax slowly between the shoulders. Melt the back to the floor, the pelvis rolling back to neutral, arms come back up. Once more the same direction. As you're breathing in, you're opening the front, tilting the pelvis forward, arching the back, moving the hands back towards the floor outside the head. Gently pull the elbows to the floor and the scapulas in towards the spine. And just notice if there is movement behind the scapulas. And can you sense the upper part and even the lower part of the back is getting tighter and more arched? My hands are relaxed. Slowly release. So now let's go to the opposite direction. So you start to breathe in, and as you breathe out, Roll your pelvis back towards the chest. Your hands are sinking down to the floor outside your hips, and allow the shoulders to lift up from the floor. They're releasing from the backside, pushing the hands gently towards the floor as your shoulders are being lifted up. Without strain, without any force, just let it be soft. Chest is getting closer to the belly, pelvis closer to the chest. Slowly release. Front is being released gently, and the arms are coming back to neutral. Once more, breathe in, breathe out, sink to the floor, roll the pelvis back, arms sinking to the floors outside the hips, palms down to the floor, chest and ribs sinking down to the belly, and allow your shoulders to move up towards the ceiling, and allow your neck to bend, and your head is still in contact with the floor. And come back to neutral. And now let's move slowly back and forth in both directions. So you start by breathing in, arching back, tilting pelvis forward, lowering your hands back outside the head on each side, pulling the shoulders closer to the spine, elbows to the floor, releasing the front, releasing the neck. It's soft and gentle, it could be micro movement. Slowly come out, hands up to the ceiling, flatten your back to the floor, rolling the pelvis back, hands are lowering to the floor outside the hips, palms facing down. Shoulders are being gentle, lifted up towards the ceiling. Please bend your neck gently and come out of that one. So you maybe notice that when I'm talking, it's not stressful force. If I use lots of energy in the movements, you maybe would notice that in my voice. But I'm using very little force, very little energy. I can do this by talking and breathing. So once more, breathe in and arch the back, tilt the pelvis forward. Move the hands back towards the floor outside the head. There's a cactus arm or hands up. Tightening between the shoulder blades back. Elbows to the floor. Front is open and free. Backside is tight, especially between the shoulders and upper part of the back. Release the back, release the shoulders. Continue the movement, flatten your back to the floor, roll your pelvis back, lower your hands outside the hips, float your shoulders up towards the ceiling. Allow your head to bend back, tighten the front, shortening the front side. And slowly release out of that. And when you come back to neutral, you can straighten your legs if that feels comfortable for you. Arms resting on the sides, and just sense what you feel. Maybe there is a difference now than when you started. Maybe you're more relaxed. Maybe there is more of the back closer to the floor, and maybe even the shoulders are resting closer to the floor. So now you're going to learn another movement. We're going to do a twisting movement between the shoulder and hip, laying on the side. So please roll over to the right side, or just pick a side if you want to. You're laying with a 90-degree angle between the knees and the thighs, and the legs are 90 degrees angle. And also a 90-degree angle with the thighs and the front side of the body. The lower arm closest to the floor, you might rest it just outside your body. You could rest on it if you want to, or you could have a cushion under your head if that feels better to support your neck, or you can lay flat on the floor. The upper arm, just leave it on the outside, on the body. So your hand might be resting outside the hip. So what we're going to do, we're going to start by twisting the shoulder. We're going to go forward and backward with the shoulder. So and put it together with also a twist in the hip and pelvis. The reason for this is because we are training your brain to move with more ease. So it's like walking. Shoulder and hip are walking in opposite direction, and the freer the spine, the freer the muscles in the center are, the more freedom we have in walking. So this will help you to reduce tensions both in the center of the body, but also in the pelvis and hips, and then upper back and shoulders. So as you're laying there, would you please pull your shoulder back in towards the spine? So your shoulder blade are gliding back towards the spine. And your arm might roll together with the movement of the shoulder, or it can just rest on the outside of the body. So gently pull the shoulder blade back towards the spine, slowly release. And then one more time, as you're breathing in, pull the scapula closer to the spine. And slowly come out of that one. And one more time, as you're breathing in, pulling the scapula into the spine, notice if you can open and free the front of the chest and shoulder, and can you sense the back side of the scapula tightening, scapula moving along towards the spine, and release. And this time you're gonna pull the shoulder forward towards the chest, towards the sternum. Just notice if you can feel the tightness in the chest and the front of the shoulder, and the back side of the shoulder is releasing. You're freeing the upper part of the back. Slowly release from there. One more time, breathe in to get ready, and as you breathe out, pull the shoulder forward. And if you want to, you can also roll the arm gently forward. And come back out. And let's do that one more time. So you breathe in to start with. As you're breathing out, pull the shoulder forward. You might roll the arm if wanted. Notice if you can sense the front side is getting tighter, and slowly release. So let's use the movement back and forth. So as you breathe in, you're opening the front, pulling the shoulder in towards the spine, tightening up behind the scapula, release. Come back to neutral and go through neutral and come forward. So pulling the shoulder forward, you might roll the arm as well. Come back to neutral. Gently breathing in, open the front, activating the back side as the scapula is gliding in towards the spine. Slowly come back out. Come forward again. Feel if you can sense the scapula is gliding over the ribs on the upper part of the back, and come back to neutral. So this is the shoulder. Now we're going down to the hip. We're going to do exactly the same thing for the hip. We're going back and going in front. So it's a twisting movement of the pelvis and the hip. So imagine you have something in behind you, close to the pelvis and glute. Would you please pull the hip and pelvis back? So the upper hip and pelvis, pull it backwards. So there is rotation in the pelvis, and you might notice that the thigh and the knee is gliding back over the under thigh. And then slowly come back to neutral. And one more time, pulling the hip back, the thigh and the knee is gliding along with the pelvis. Come back to neutral. And if you feel that it's difficult to pull the pelvis behind because the whole body will join, then you can leave your hands in front of you, lock them in front of you. and you can pull the hip and see if that's easier to keep the rest of the body more still. Come back to neutral. And then you do the same thing forward. So your hip and your pelvis and your thigh and knee is gliding forward, straight forward, gliding over the upper thigh. And come back to neutral. And once more, you're pushing gently the hip, the pelvis, the thigh and knee forward, and then come back to neutral. And the last one. Rotating, twisting the pelvis, pushing the hip, thigh and knee forward, and let it be a small, juicy movement. So let's bring this back and forth together as one movement. So you pull the pelvis and hip back, thigh and knee is going along with the twist. Come back, go through the neutral. Push the hip, thigh and knee forward. Come back to neutral. And then slowly go back and forth. So it's a rotation of the pelvis, twist, and soft, gentle movement. And here as well, if it's hard to move the pelvis isolated, you can lock your hands and see if that maybe helps to isolate more in the lower part. All right, so let's bring this all together as one movement. So imagine you're outside walking, hip and shoulder are going in opposite directions. So really slowly push hip forward and stay there, and pull shoulder back. And then come back to neutral. And one more time, push hip and pelvis, thigh and knee forward, pull the scapula back into the spine. And come out of that one. And once more. Hip and pelvis forward, shoulder in the back. So now there is a rotation and twist in the spine, pelvis and lower part of the body is twisting forward. Shoulder and upper part of the body is twisting backwards. So there is kind of a spiral movement in the spine. And come back to neutral. So this time, pull the hip back. Pull the shoulder forward. And come back to neutral. And once more, pull the hip and pelvis back, shoulder forward, lower body twisting back, upper body rotating, twisting forward, coming back to neutral. And the last time, pelvis back, shoulder forward. Come back to neutral, and let's bring in this as one movement. Pelvis forward, shoulder back. Imagine you're taking a step forward. Hip back and shoulder forward. You're swinging the arm as you're walking along. Hip forward, shoulder back. Hip back, shoulder forward. And when you can control the movement and you feel that you have fluid movement, you can actually increase and go a little bit faster. Shoulder back, knee and hip forward, or hip and knee back and shoulder forward. So the opposite direction. Like you were out walking on a Sunday, just walking around, enjoying being present in the moment. And release, relax, and turn over to back. And just sense what's there. Maybe you can feel that you are more tilted to the side that you have been activating. Maybe you feel like you're longer or heavier on one side. So whatever you feel, it is what it is. Let's do the other side. So again, you're laying down, 90 degrees angle, and the body and thighs 90-degree angle. Resting on the cushion if needed. You can leave the underarm anywhere you want to, and leave the upper arm on top of your body, on the outside of the body. So gently start with pulling your shoulder in towards the spine. And notice if you can feel the shoulder blade glide over the ribs. Come back to neutral. And then you repeat once more, pulling the shoulder back, open the front. Come back to neutral. Slowly move the shoulder forward. You can roll the arms along if you need to. Sense if you can feel the tightening in the front. And release. And once more, bringing the shoulder forward, releasing the back side. You might roll the arm as well. And then you can go back and forth, slowly pulling the shoulder back. And release. Slowly bringing the shoulder forward, you might roll the arm. Noticing and sensing if you have tightness and contact with the front side, releasing the back side. And as you bring the shoulder back, tightening the back, opening the front. Back and forth, really slowly and gentle, within your comfort zone. Come back to neutral. And let's do the same with the hip. So we're not having so many repetitions on this side because your brain knows what you're going to do. If you need more time, of course, you can spend as much time as you want to. So let's bring in the hip. It's the same rotation and twist. Gently pull the hip and pelvis back. And notice if you can feel there is a twist also in the spine and in the center of the body. Come back to neutral. And once more, glide the pelvis and the hip back. Twist the pelvis. Come back to neutral. And if you need to isolate more because the whole body will join, you can of course lock your hands, put them in front of you, and see if that maybe helps you to use more isolated movements from the center of the body and pelvis. Pulling the pelvis and hip back, and come back to neutral. And repeat in the front. So you're pushing the pelvis and hip forward, and the upper thigh and knee is gliding over the under thigh. Forward. Come back to neutral. And also notice again when you're gliding the thigh and the hip forward, can you sense the twist in the center of the body? Can you feel anything going on in the back side of the pelvis, or maybe in the front side? Come back to neutral, and then you can go back and forth, slowly coming back. Really slow release. Come through neutral and gently push forward. Just a couple of times back and forth. Back and forth, back and forth. Good. So let's bring these two movements together as one. So please gently push the hip and pelvis forward. You stay there, and then you pull the shoulder back in towards the spine and come back out. And then you repeat, pulling the hip, thigh front and front, and pulling the shoulder back, coming back out. And then you pull the hip and thigh back, rolling the shoulder forward, come back out. And one more time, hip back, shoulder forward, back side is released, upper top of the shoulder, front side tight, come back out. And then we go back and forth in the opposite direction. So knee and hip forward, shoulder back. And then hip go back and shoulder go forward. And then hip and thigh go forward and shoulder go back. And use it as much time as you need, and hip back and shoulder go forward. And when you have control of the movement, maybe you can speed up just a little tad, just a little bit. Back and forth, shoulder one way, hip the other way. Just like you're out walking and enjoying being present, moving your body like a model. All right, come back to neutral. You can turn over to your back and then do a little scan again. And you might feel that you're laying on the floor more equally, maybe there's more of the same pressure on both sides. Maybe the shoulders are relaxing more, maybe the upper part of the back is more relaxed. Okay, so we're going to do the last movement for now. So put the feet to the ground, and the right arm is being laid to the side in a T. Left arm is just resting on the side of the body. You take the left thigh and leg, put it over the right. So thigh resting towards thigh, just like as you were sitting with the legs crossed on a chair. And won't you gently melt both your knees towards the left. So as your knees are melting to the left, the top leg are guiding the lower leg over to left. And the weight is going on the inside of the right foot. So when I'm melting the knee to the left, my right side is opening and lengthening. It's no stretching, there is no pushing. It's just a natural opening and release of the outside. And then come back to the top. And one more time, you're melting the knees over to the left, opening and lengthening the right side of the body, and allow the head to turn to the right. So knees and head is going opposite directions. Come back up to the center. So again, here we are making a spiral movement and twist in the spine. Pelvis and legs in one direction, head in opposite direction. And then come back up. So now we're going to bring in the right arm. We're going to work with the upper part of the back and back side of the shoulder of the right arm. So as you're melting the knees to the left, head is rotating gently to the right. Gently push the right shoulder towards the floor and in towards the spine. So the upper part is getting more tight on the right side as the right side is opening and releasing from the waist and down, opening the chest, knees melting to the left. And come back up, release the shoulder and upper part of the back, releasing back to center with the pelvis and the feet or the legs. So once more, as your knees are melting to the left, head turns right, slowly like a spiral movement. And as you're melting the knees over to the left, please, you can even press the arm closer to the floor and pull the shoulder closer to your mat and in towards the spine. So you're activating the upper part of the back side of the shoulder. And of course within your comfort zone. And release, come back to neutral. And one last time, breathing in as I melt my knees to the left. Resting on my inside of the right foot. Head is turned to the right. I'm pushing my right hand and arm towards the floor. And notice if you can get in contact with the back side or your right shoulder and upper part of the back without straining, without using force, and slowly release. Shoulders is relaxed, turning your legs back to neutral. And then you can straighten your legs slowly, leave your arms along the side, and just notice if there is any sensation and feedback from either the waist, the pelvis, or maybe you can sense also the upper part of the right side of the back and the shoulder. And then put the feet to the ground again. Right arm is resting on the floor. Right leg, thigh over thigh. Right leg is resting on the left. Left arm resting outside in a T shape. So once more, as you're breathing in, melt both your knees so the upper leg is leading the way down towards the floor. They're going in the same direction. There's a spiral twist in the spine as the knees are melting down towards the right. Left side is opening and lengthening, no stretching involved, just a natural lengthening of the muscles. And come back to the top, and maybe you can feel that as you're lifting the feet and legs back to neutral, there will be activating of the muscles in the waist, maybe the back, maybe the belly. One more time, as the knees are melting to the right, allow your head to tilt gently and slowly to the left. So head and knees in different directions. Come back to neutral. And one more time. Knees to the right, melting really slowly. So there is no dropping of the knees, they're melting. They're being guided down towards the right side. Turn head to the left, and now gently push the left arm to the floor and pull the scapula closer to the spine. And allow the neck to join the movement. No force, let it be a nice and gentle contraction. Release the shoulder, bring the legs back to the top. And the neck and head also turning back to neutral. And once more, knees melts to the right, head turns gently to the left. Left arm closer to the floor, left scapula closer to the floor and in towards the spine. Left side is opening and lengthening, no pushing of the knees to the left. They're just releasing as long as they can go as a natural opening of the waist. Come back up, releasing the shoulder. And one last time. As you're breathing in, melt the knees to the right, head turns left. Left arm closer to the floor, shoulder blade in towards the spine. Relax the neck, release the shoulders again, and then come back up with the legs. And then put the right foot back to the floor, straighten your legs, and then just sense and notice if there is any difference now laying on the floor. Maybe there is sensation, maybe there is a difference. Maybe you can feel that your muscles have been activated, you have been working with your muscles. So let's go into a short scan again. If there was a difference between the right and left side when you started, is it different? If you felt that there were parts of you not resting on the floor, how was that now? And if there was a difference between the right and left leg, what's it like now? And if there were a difference between the pressure of the pelvis, maybe you were tilting on one side to each other, towards one side, heavier on the floor on one side, is it more equal now? And also sense the pressure of the back to the floor. Maybe there is more of you resting heavier on the floor. notice the scapulas and the shoulders. If they were lifted, if there was a difference between the right and left side, what is it like now? If the front side was lifted up and you were feeling tightness in the front, maybe the front side is more relaxed as well. And the neck, if it felt stiff or it was feeling like it was bending back, what is it like now? And also notice the breath. Maybe there is more freedom in the breath. Because as you are releasing tensions in the back side and the front side and the outside of the body, and you're releasing tensions along the ribs, you might have more freedom in the breath as well. Now you can lay and rest as long as needed. And whenever you feel ready, you can start to move your hands and your feet. You can yawn. You can stretch or curl like a ball or rotate as you need to. And when you are ready, please turn over to one side and you can sit up again. I hope you like the program and feel more relaxed in your body. So the upper part of the body has been moved. Also the pelvis has been moving. You've had rotation in the spine and you've had work with the front side and back side. But mostly the upper part of the body has been on main focus in this program. So I hope you enjoy them. I hope you have benefits. Practice daily and see what it's like just in a few days, just in a few weeks ahead. When you have been doing these movements for some time, you might feel that it feels different to be you. Maybe there's more movement, more freedom, less pain, muscles relaxing more, better muscle function and muscle control. I'm wishing you the best and I see you later. Bye bye.